From Flourish DX, this is the Psych Health and Safety Canada podcast, with workplace mental health becoming a priority for businesses who want to retain staff and prevent burnout. This is the source of information for creating sustainable and psychologically healthy workplaces in Canada.
Welcome to Psych Health and Safety Canada podcast. And today I'm hoping to take a trip down memory lane with one of the very first corporate people that I spoke to about workplace mental health and psychological health and safety. And I remember being surprised that this person had the same level of passion and thought leadership as some of the greatest minds in the field. And so I'm really happy to welcome Steve Sproule to the podcast today. And welcome, Steve. And I wonder if you can start with telling a little bit about how because you started the journey to psych health and safety before there was those words. So can you tell us a little bit about your journey?
Oh, thanks. Thanks for that introduction, Marianne. That's very flattering. And it's true. I think myself and my team were very passionate about psychological health and safety. And in response to your question, it might sound a little self-serving. Back in the day, as a benefit manager, it was all about controlling costs. And we would look at it and say, well, we can reduce our coverage. We can increase our cost share with employees, or we can try to reduce the claims. And it was really only the third option that would allow us to still meet our objectives of being competitive and looking after our employees and the retention and all the things we look to benefits to do. So when we started to look at our claims, if we look at our cost drivers, probably 7 of the 10 therapeutic classes for drugs were psychological based in some way, if not directly. So we started to pay attention to that. And I can go into that in more detail. But the other significant catalyst was we had a meeting with, perhaps a shout out to Homewood back in the day, Kelly Lutmar and Associates. We asked them and they did our short-term disability programs and management. And I said, what is the next tsunami? What do we need to be prepared for? And they did not hesitate, Marianne. They said, prepare for an onslaught of mental health and mental health related claims. And really that was the bell that rang. And we said, all right, let's go there. And that was the catalyst for our mental health initiatives.
So what year was that you were first looking at it, Steve?
Probably late 2000s.
Yeah, late
2009, 2010.
Yeah. And the standard wasn't released until 2013. So you really were cutting edge at the time. But there's a statistic that you shared with me, Steve, that really made me chuckle. You asked when the first Mental Health Awareness Month was ever declared. And many of us think, we started thinking about this in the 90s and in the 2000s with the advent of Guarding Minds and then the standard. That's when it became big. But what was the year the first Mental Health Awareness Month was declared?
Gosh, Marianne, it's actually really shocking, but I believe it was 1949.
Yeah.
Yeah. It's amazing, eh?
Yeah. So those of us, and this is something I've said most of my career, Steve, is there's really nothing new under the sun. I remember creating a process to help somebody develop a plan when they had a mental illness. And I thought I made it up out of thin air and that it was really effective. And then I found that 35 years before me, somebody had created something very similar. And yeah, there is nothing new under the sun, that's for sure. And so when you are with Husky and you're looking to save money and you realize that this is the way to do it, can you Share with us some of the successes that you had. What were some of the programs and initiatives you put in place that really helped get you towards your goals?
Gosh, I'm going to start, Marianne. We had really supportive leadership, and I really admired their open-mindedness. Doesn't mean it was always easy. I remember one of our senior VPs saying, do you want people to think we have a mental health problem? And I wasn't really sure how to answer that, except not to say that we had one or not, but we would like to make people aware of it. I think a couple things come to mind. One of the major challenges with mental health, both awareness and care, is the stigma surrounding it. So in many ways, a lot of what we did was to try to reduce stigma in the workplace and stigma around mental health. So an example, with our employee and family assistance plan, back when I started, I think our EFAP utilization was around 6 or 7%. We recognized that, or understood, a well-utilized communicated program was sort of that 10 to 12 range. We started using the EFAP, or promoting the EFAP, for non-psychological support. We started promoting the other aspects of the program, the family or communication or managing work-life balance, or just non-clinical services. And we put together what we called a turnaround survival kit. So a turnaround, we had East Coast operations. It was a really high stress environment. You shut down the refinery for 2 weeks, and you bring people in from all different industries, and you basically revamp and do a tune-up on the refinery. We put a kit together that didn't talk about psychological safety. It talked about getting good sleep, how to communicate with others, working with different people, all these other aspects. But the hidden message was the employee and family assistance plan does more than just help you when you're in distress.
Right.
So it became to normalize the EFAP and awareness. Another thing that sounds really simple, when I started at Husky, we didn't have a pay direct card. And we got one. And on the back of it, Great West Life was our carrier at the time. And I said, on the back of it, I'd like you to put our EFAP numbers and those numbers. And I hope I'm not offside on this. They said, well, that's where we put all the information in French. Well, we don't have any employees in Quebec. So with all due respect, would you honor our request? And they did. So we looked for ways to normalize and build awareness. We also established a tremendous partnership with our corporate communications people and our other HR. Well, I'll start with communications first. And we would meet with them once a week. We had a dedicated communications individual, and we'd have an article. And it wasn't always about psychological safety, but it was somehow related to overall employee wellness. And it wasn't far from that. So it was through these types of strategies, Marianne, that we started to build awareness. We had our HR VP at the time. We had a program called One HR, and we're a team. So we had our diversity people, we had our HR, the various folks that would work with the leadership team on hiring and promoting and all the things that HR does. We would partner with them, and it was a One HR. We were in it all together to promote. Everybody brought a tool to that tool kit to promote HR. One of the really fun things we did is we had flu shots. Everybody did flu shots.
That's a fun thing.
Well, I had fun. What we did is I'd never had flu shots before. So I said, okay, this is cool. We'll do this. And then they said, now you got to stick around for 15, 20 minutes, make sure there's no reaction. I said, okay. So we went in a room to sit and wait around, and I think they were playing Top Gun, and everybody hung out there all day watching movies. So probably not the best use of time. If they've come to the center to have a flu shot, have a healthy experience, let's give them more healthy things. And from that, we evolved to have a full week wellness fair. And every day of the week, we would have something special. But 2 or 3 days of the week, we would have, the whole conference center. We would have, various health suppliers, whether it was Heart and Stroke or the Canadian Cancer Society or the CMHA or the Mental Health Commission. We'd have a number of them in, and as well as our carriers and vendors. So those were probably some of the primary methods, Marianne, where we work to promote and develop and perhaps normalize the benefit offering and the services available.
Yeah, I think that there's some organizations that don't really leverage what their providers can and are happy to do, whether they supply materials or they supply services or whatever they supply, for you to say, how could you help improve employee wellness? And many of them are like, oh, great, this is what I could do to contribute. And you started that long ago in order to make that happen.
Well, if I may, it reminded me of a fun, again, it was fun, a story. We would bring our EFAP provider in, we bring our disability, short and long-term providers in, and we would have quarterly claims review meetings. And we would look at people that are perhaps in the waiting period, people that are returning to work, and how will we accommodate them. And it was unique in that you had 3 different primary providers that typically would compete against one another. And we were really struggling, to get them to work together. And we were going into a meeting, and I said to my colleague Sandy, I said, go get a bunch of husky hats. And she did. And so before the meeting started, we passed a hat around. Everybody had a husky hat. We said, look at yourselves. You're all wearing a husky uniform. You're on the same team. And they started to laugh, and all the protection dropped, and they started to work together. And I said very clearly, I said, we want nothing more than for you to compete bloody hard out there. But when you're on Husky's time, we need you to work together. And they started saying things, Marianne, I really have to give them a lot of credit. They started saying things to one another. Oh, you could do that? You mean we could access that service from you to help us in this regard? He said, we'd love you to do that. And so I think they enjoyed that too, because it was a unique way for them to serve a valued customer.
Well, and that's it. You're not asking them to just quote, you're asking them to collaborate on helping your employees, and really everybody working together to that end. And, we look at, there are organizations where union and management both agree that employee well-being is important, and they collaborate effectively in that area. It's just a matter of rethinking the approach, right? And I don't know, I think everybody's going to go out and buy hats now, so that they're never mind on the same page, you're under the same hat, therefore.
Yeah, it was a fun analogy. And I think, again, I've been a provider, and, it would make, if they're playing like that and being unique with us, it's going to be harder for a client to replace them as well. So
Right.
From a selfish perspective, it serves their need to be providing a unique and valued service that's integrated more than just their client, but also their other client providers.
Yeah. Now, Steve, you also talked about collaboration with other partners. So you talked about your HR, but I know in your plan, you had your communications folks, you had your frontline leaders and others. Can you talk a little bit about how you got each of those groups involved and what you asked of them?
With communications, for starters, this was fun. I said to, again, our VP of HR, this is early on in my Husky days. I said, who's in charge of corporate communications? And he told me the name. I said, I want to book a meeting. What do you want to talk to them for? So, well, I think we need them. I think we need them to promote, like we're spending upwards of 25% of payroll on benefits. And if we're not telling and promoting, it's a waste of money. So it probably started with the impetus of making people aware of what we have. If we want to have benefits to attract and retain employees, we got to tell them about it and promote all that they're for. And that's how it started with communications. And I think they actually enjoyed it too, because they would have positive stories to tell. And we could run a theme. And gosh, before we all had benefit and administrative websites, we had an internal website that was dedicated to benefits. We worked with corporate communications to develop a quarterly newsletter. This sounds so old now, but it wasn't in existence back in the day.
Yeah.
So that partnership with communications was huge, and we would share our successes with them. As a result of what's happening, here's what we're seeing with trends and whatnot. Another area probably more targeted to health and wellness and certainly psychological well-being was our health and safety group. And they had it was called the Husky Operational Integrity Management System, or HOIMS. And their mandate was all to safety in the workplace. And I really applaud the energy industry for their focus on safety, both from an environmental perspective and obviously a employer civilian perspective. But they just talked about health and safety in the workplace, or personal health. But you had to dig deeper, and they actually, in their documents, Marianne, differentiated physical and psychological safety. They recognized the two and the importance of it. And my little mantra to them was, they were all about alcohol and drug or substance testing. That's great. My comment to them was, you do not need to be impaired to be intoxicated. You do not need to be intoxicated to be impaired. If you haven't slept, if you're distracted, if you're not on, if you're all these other impairments, but I could be quite clean, it compromises safety in the workplace. So we struck a really healthy partnership with the health and safety team, and this was part of their HOIMS rollout.
And how did they start? I think, especially in safety sensitive organizations, the idea that you understand if your employees are not focused, if they're distracted, whether that's because of something going on at home, because of conflict in the workplace, because of a problem with their supervisor, it's a danger. Like, it is a physical safety issue. How did you get the health and safety people to start to take action that made a difference?
It's everything that you just shared, Marianne. And it was conversations like that. Somebody might be struggling with other, I'll call it demons, and maybe they're self-medicating, and that's why they're using substance. We just had those conversations. We talked a lot with them, and they came around. We'll let you guys, being a bit facetious, we'll let health and safety look after the slips, trips, and falls. And we'll look after the psychological and support them in that side. So we could be a tool in their toolkit. And then, when was it? 2013 or 20 thereabouts, or 2014, the National Standard on Psychological Health and Safety in the Workplace came down. Well, that was a huge boost for us. And I was very fortunate that I had an opportunity to meet some of our board of directors. And I had a couple minutes with the fellow that was his portfolio was health and safety, and I shared with him that the standard had just been published, and he was wonderful with no hesitation. What are we doing about it? Right, that was the ticket. That's all we needed, and off we went.
I'm really pleased to hear you say that, because that was the entire intent. Is you've got this arm's length, consensus based, so no one interest group promoting something for businesses, and we were hoping that it would happen exactly as you describe it. You say, well, there's a national standard, and they say, okay, then we need to do it, as opposed to this would be a nice thing to do, you know.
I think I mentioned earlier we had great insightful leadership. I'm not saying that we easily were given everything we asked for. We put business cases together, but they were open to it. They wanted to do the right things, and we may or may not talk more about it today, Marianne. But this whole phenomenon or wave about ESG now, in environment, society, and governance, and I think there's a huge place for workplace health and psychological health in the social aspect of ESG.
Well, it's interesting, you know, when I think about the evolution, we were first talking about employees with mental illness. Then we started talking about workplace mental health in general, not just for employees who had mental illness. And then psychological health and safety was going back even further, that it's about the organization taking responsibility for the impact that they have on all employees. And the irony of it all is, when you have a psychologically healthy and safe workplace, it has a very positive effect on those who have a diagnosis of a mental illness, even though it's meant for 100% of the employees, not for the 8% that statistics say are currently dealing with a diagnosis. So it's been part of that. But going back to people with experiencing mental illness, you had a program called Rapid Impact. And can you tell me a little bit about how you were able to get help for people with addiction or mental illness faster and more effectively?
Yeah, thanks for bringing that up. Again, it was working in partnership with our suppliers. So I'll tell you a lot more, or ultimately Homewood Health. And, you know, and I'll back up a little bit. Back in the day, ours, like all organizations or most organizations, psychological coverage was part of our paramedical package of offerings to our benefit carrier. And, you know, the numbers, the maximums, if I told you now, it'd be quite embarrassing, but they were competitive back in the day. We carved the psychological health out. So you'd have a maximum dollars allowable to that wouldn't be eroded with chiropractor or physiotherapy or the other paramedics. And again, we went back to leadership a few years after that, and we had that amount increase significantly. And then subsequently it was doubled as the journey continued on. And with Rapid Impact, we would work with our short-term disability carrier, it was KLA, and we said, if anybody's experiencing any, I don't want to say symptoms, but if there's, psychological challenges, they get carried away. There's no waiting period. We're going to just almost immerse them right in, kind of skip the queue and get the care and support that they need. Really no questions asked. And that was really well adopted. But if I may, probably one of the programs that we had the most success with was a program with the Mental Health Commission of Canada called The Working Mind. And this was a program originally delivered to the Department of National Defense called the Road to Mental Readiness. And I was very fortunate. Might have been at our wellness fair, and I was standing beside one of the VPs of the commission, and he was talking. I don't even know if he was talking to me, but I overheard the conversation. And he said, "We've got this program called the Road to Mental Readiness that we want to pilot with an employer group so we can study it and make sure it's evidence-based. And if it is, then we can roll it out." And I said, "Gosh, we're looking for a program just like that. We would really like to partner with you if we could." So we did just that. And we partnered with the commission, and it was studied and researched by researchers from the University of Calgary. And it was delivered to office workers and field workers. And it was embraced. It was really, really well received. We had a decrease in stigma, I think, of about 9% and an increase in resiliency of about 7 or 8%. And that program, I think the pilot was probably 2013, and it's incredibly successful program now across Canada. So not exactly the early intervention program you asked me about, but very similar, Marianne, and it really helped to make mental health and psychological safety. It showed that Husky really cared and took it seriously and was helping both leaders and employees in that regard.
One of the interesting things about that program is it started with the military. So when you think about many of the people in workplaces who were not ready to talk about mental health and mental illness, and to do it in the way that you would talk to soldiers in the field, took away a lot of that stigma. It's like, well, of course our mental health is affected. It's a part of the human condition, not a weakness, not a failing, but something that most of us will experience at some point to some degree. And I think that's why it was so successful.
Yeah, and when the more we spoke about it, and the more, this was a fun idea that we got part of. Prior to every meeting that was held at Husky, certainly in HR, but I think with all meetings, there'd be a safety moment. So somebody would be tasked with, hey, Steve, will you do the safety moment for this meeting on whatever? So I'd have to come up with one. That evolved to a health, diversity, or safety moment. So whoever was asked to do the moment would have a choice of those 3 disciplines: health, safety, health, or diversity in the workplace. So it's interesting that, those things became very cultural, and it made it easier to talk about, made it comfortable to talk about those subjects in the workplace. And from a psychological perspective, certainly reduces stigma and therefore barriers to care and access to care. So people were more comfortable, didn't see it as a weakness, saw it as, gee, I better look after myself, and take the steps to do it the same way they would for a physical injury or illness.
Yeah. And I hope that that's what's happening in society, but still, I think what you were doing was, groundbreaking at the time.
Thank you. Thank you.
Yeah, really thinking about this. Now, something else that we've been focused on all year, and certainly throughout the pandemic, because of different things that have happened, is the concept of inclusion. And again, I think it's a testimony to yourself and to the folks at Husky that you've been looking at diversity and inclusion for quite some time. Do you want to speak a bit about the work that you've done in that area and how it ties to psych health and safety?
Yeah, I'll share what I can. I don't know if I'm really all that well versed in it, Marianne, but we would work closely. We had a good, going back to the one HR. I had a colleague that was in charge of diversity and inclusion. So when we would, if we were doing an initiative that might touch on, if there was any blurring of lines, and she would do the same, we would speak and we would talk and we would say, how might we leverage, or promote or mention, the other disciplines or the other party's disciplines. So really it was just working together. I think really that's probably about all I can say. Sorry.
Yeah, no problem. We're looking at, so we did a lot of roundtables and research around inclusion, thinking about what needs to be different. And the decision that we came to in the end is inclusion is psychological safety. When you feel that you belong, when you feel that it's safe to speak up, both about ideas and about concerns without fear of retribution or repercussions. And so in a psychologically healthy and safe workplace, there wouldn't be a need for something separate for inclusion. But sometimes we have to pull it out so people understand the subtle ways that they don't include people from different backgrounds, but also people with different ideas, different opinions. And one of the things, Steve, that people will say is, well, we want you to bring your whole self to work. But the reality is that my whole self might be a negative, argumentative, cranky person today. And do you really want me to bring all of that to work? And psychological safety says that's just a part. And so I'm curious with you how you would deal with people who maybe were going through a hard time in their life, but the negative impact they were having on others was significant. How would you deal with situations like that?
Good question, Marianne. First of all, I really liked what you said about feeling safe to express or share ideas and thought. And I think personally for me that was a great learning experience. And we'd have people on our team, and I'd say, I really want to hear from your perspective, and you'd have to, if they were comfortable sharing. But then you also have to respect that comment. They might say that idea really makes no sense for these reasons. Okay, well, let's talk it through. The majority of the time, what you end up with is a stronger mousetrap than where you were going. It may not be the one that you started with or the one that other person asked, but through the input and the diversity of thought, you'd have a stronger outcome. And that really only happens with the respectful environment around the table, where people say, okay, that is a different view, Steve. I hadn't thought of that. Let's explore it, or we'll have to dismiss it. You just have to be respectful in the way you deal with it. And I deviated from your question. That's not exactly what you asked me, though.
Well, no, but it is all part of that. It is the idea that we can, first of all, get our egos out of the way, that if somebody disagrees with us or says, I have a different way of looking at that we don't get our back up and say, how dare you disagree with me? And of course, that has to start at the top, and it has to be modeled by the leaders in order for it to be safe for the other employees. But at the same time, we have to learn how to respectfully disagree. I remember many years ago now, I was called into a university where there was problems with the faculty. And what I heard is that they would call each other terrible names and put each other down, and they called it academic freedom. Well, I have the freedom to express my opinion. Yes, about an idea, not about the character or personality or morality or integrity of another person. And so it led to creating rules of engagement that you wouldn't think were necessary for highly educated adults, but turned out to be in this case. And so I always feel like we've got to have that balance. But if we don't teach people how to interact respectfully, then it's not fair to expect that they just know.
No, and well said. And I, as I'm listening to you, I'm thinking, if somebody's having a psychological challenge, or that's not an excuse for bad behavior. Like, I recognize that, all right, you've got some challenges, but that doesn't give you the freedom to be disrespectful or even cruel to your colleagues. There is a standard of appropriateness that has to be met.
And it's also an insult to the millions of people with a diagnosis of a mental illness who would never be disrespectful or rude. It is not the illness made me do it. The illness may make you more inclined to think that way because it is changing your mind. But in the vast majority of mental illnesses, your behaviors are not dictated, and there are ways to learn. And if you can't, then maybe you do need more treatment in order to be able to do that.
Yeah, no. So we would, I think deal with those situations, Marianne, the same way we would with anybody that was acting or behaving disrespectful in a meeting or the workplace. That's just not the protocol. And call them in.
Yeah, that we hold people accountable in a respectful way, but we do it promptly and we do it effectively. So that's always a good thing.
I don't know if this is appropriate right now, but I'm reminded of it. We went out to the field years ago and we had a nutritionist speaking to a number of rig hands. And this hopefully comes across okay. Really slight, tiny, soft-spoken young lady. And she's speaking to oil field workers. So the guys are in the overalls, pretty dirty, grubby, hard. I mean, they're roughnecks is what they would be called. And she was wonderful. She was doing a great job. And I'm standing at the back of the room. And there was a younger rig hand. And he was getting a bit chippy. He was a bit off. And, a couple comments, he was being a bit rude. One of the older rig workers, probably rig manager, he literally cuffed this kid on the back of the head, said, "Pay attention, she can save your life." And I was like, awesome. So, leading by example, that was great. And I was so proud that the older gentleman recognized the importance of nutrition in staying safe.
Steve, just to be clear, you're not suggesting we cuff people in the back of the head.
No,
I don't.
No, I'm not. It works.
I coached baseball for 8 years, and some of my training was with the Blue Jay staff. And there's a man by the name of Dave Stewart, used to be a pitcher. And he said to me that humiliating or threatening people is not the way to coach. It's not the way to support. No. However, if you have someone who was brought up that way, where their parents were really rough and threatening, he said it does have the effect of making them pay attention in the moment. It still doesn't give you long-term commitment. But he said it is unfortunate that some people use that fear, that reaction in the workplace, and because sometimes it does work. But in the long run, especially in this market where talent is tough to get, tough to retain, it's not the way to go. Threats.
No, I totally agree with you. But what was really powerful was leading by example.
Right.
Where you had this individual that everybody looked up to, and he did it in perhaps not the most appropriate way, but he got his message across.
Right.
That this is important, and I'm paying attention. I think you should too.
Well, I remember, and it would have been maybe a dozen years ago, and I went up north to a very male-dominated place, and I was to speak to them about mental health. And the vice president pulled me aside before I went in. He said, I just want to warn you, these guys, they're pretty rough and tough, and they may heckle you. They may get up and walk out. I just want you to be prepared so it's not upsetting to you. Just ignore them. And so I went, because I had never had that experience before. Well, I went in, I did my entire presentation. They lined up afterwards to ask about themselves, their wives, their children, their loved ones. And it wasn't that at all. And I think sometimes we do have generalizations about people. And today, I think that a good percentage of so-called blue-collar workers are emotionally intelligent. And yes, we still have the roughnecks and the people that aren't, but I always think, I wonder what you're going through. I wonder what you're experiencing right now.
And you're spot on, Marianne. And we know it's probably understated that 1 in 5 or 20% of us will experience a mental health condition in our lifetime. A higher percentage of us will know someone that has gone through one. It starts to, I don't know if it's the right word, but normalize things a little bit. It again breaks down that stigma that I'm not alone in this. This is common, and I think as that message continues to get out, and people would experience what you did, that they want to learn more.
Well, and Dr. Ron Kessler at Harvard, he said the 1 in 5 statistic came from people who got a diagnosis. He said if you actually looked at people who were diagnosable, so they're going through a time in their life where they can't sleep, they're ruminating, going over and over about something, they haven't got focus, they're agitated or anxious, or they just have no energy, that they could have been diagnosed. They just never go for treatment. He said it's more like 50% of us will actually have a time like that. And I mean, I don't think I've ever talked to anybody, at least not my age, that hasn't had that dark night of the soul, hasn't had that time where life was really difficult day by day. And that's your mental health, whether it's a mental illness or not, that's your mental health. And, like you talked about with the training that you did, the more we manage expectations to people that this will happen to you, this is part of life, this is part of the human condition, the more that we will save lives, because people know that this is not the rest of my life, this is just right now.
Yeah, no, well, very, very well said. And I'm not surprised by those statistics, actually. Yeah.
Makes sense to you?
Totally.
Yeah.
Totally. No, and I can think of many other scenarios where we've been in situations where people have shared during a meeting, which is fascinating because it tells me they feel safe in that environment to do so. And they're probably not the only one in that meeting. They just happen to be the one that shared personal experience. And again, it helps to normalize and you get, I keep saying normalize, but if people don't recognize or feel that it's okay to reach out for help or go like they would if they twisted their ankle to get the care they need, or to talk to their leader that something's not necessarily right in the work, or can we modify this? They would do that without hesitation for a physical condition.
Yeah.
And it shares they're not alone.
Yeah. And that it is normalizing. And I think it is important. I know when I was a young mother, I thought I was the only mother in the world that was overwhelmed. I thought everybody else just had it all together and, had a spotless house and their kids were always happy and everything was great. And so now that my children are grown, whenever I see a young mom, I tell her everything that went wrong because I want to normalize it. And it's the same with mental health and mental illness. The more we talk about it, the less people hide it, because the more we hide it, the more we repress it, the longer it stays with us, right? You can't really get better if you never talk about it.
No, and again, the twisted ankle, if I keep walking on it, what rest might have helped heal it, I may need surgery one day. Like it just gets worse, and as I listen to you, Marianne, I think, getting that care, that early care, but if I'm feeling great, I may not need that support, but I take great comfort in knowing it's there if I do. And I take great comfort and satisfaction working for an organization that cares for its people in that way. So I may not need that support or care, but I sure feel good being in an environment that knowing that it's there if I need it for myself or my colleagues. That's huge.
It's really huge. And the research backs you up on that, Steve, that when employees know that their organization would support them, when they know that they care, they actually have fewer sick days. They have fewer disabilities and fewer days off when they do have a disability. And so Yeah, it's absolutely true.
Mhm.
When you think back, Steve, at the very early years, you talked about the vice president who was worried that you're opening a can of worms. If you start talking about that, will it reflect poorly on you? And I remember those days too, that, the don't ask, don't tell around mental illness was the way. Let's just pretend it's not there. What other challenges did you have to overcome in those early years?
We, I think, like all initiatives or all change, as you sort of move the needle forward, it's just the business cases. It's putting. We didn't get everywhere we wanted to be easily or quickly. We would put our business cases together. We would talk about, and we would, it would be evidence-based. We would look at our data, we'd look at our claims, we'd look at our disabilities. We would partner with health and safety, like we discussed, and look for allies. It was really just building the business case. And when our VP of, I really hung a lot on safety because nobody was going to challenge safety. I mean, that was the trump card, if I can hate using that word now. But that was kind of the ace in the hole. If we could align with health and safety and align, let's see, how benefits isn't a cost center. It's an avenue to invest in the organization. And I said benefits, but for me, the benefits included the health, the wellness, the retirement plans, financial literacy, financial wellness. Now, if we could align that portfolio of offerings with the key corporate strategies and say, well, if you're putting it out there in public that these are our corporate strategies and objectives and what we stand for. Hi, I'm HR. I'm here to help. Like, no, you guys just show up when we want to fire someone. No, we we can actually be a strategic partner in the company's success. We can do more than just pay claims. Here's how. And those were conversations that we'd have, Marianne. I was really proud when I asked this question I had to be careful how I phrased this up. One of our senior VPs of HR left. I didn't want to say I was proud when he left, but when he did, I asked him a couple of questions. I had 2 or 3 questions, and one of them, I just said, what was good? Like, what did we do well? Like, what were some of the things that our team, helped? And he said, Steve, I didn't believe it at the time, but I'm glad you and your team never gave up on promoting mental health. He says that was good. He said it wasn't easy, but that was his comment back was, I'm really pleased. I'm really thankful that you and the team didn't let off the accelerator on mental health, because we probably should have done more.
Yeah. Yeah, a lot of people are seeing that now. But when you started, there weren't a lot of people who saw it. So you focused on safety because you knew that was their issue, and you also focused on retention and like part of the benefits package, that this was another strategic way. So that's great. What would you do now, if you're looking ahead for 5 years, knowing the changes, knowing we're still in a pandemic, knowing that talent's going to be harder to find, what would be your advice to organizations like Husky?
I think the first thought that comes to mind, Marianne, is be open-minded. Ask questions, do the research, work with your suppliers, work with your EFAPs, work with your the Mental Health Commission, work with CMHAs, work with those not-for-profits. Look, they're here, they're there to help too. Try to be different, try to be unique. We're I love that quote. doing the same thing and expecting the outcome to be different. It's the definition of insanity. Like you have to, things evolve. And I think early in our conversation today, you shared nothing's really new. It's not, but it's got a different flavor to it. And how we get there. Have those challenging conversations. How could we do this better? Reflect on what we've done. Nothing wrong with what we did. Might there be a better way to do it next time? And just keep that open conversation going. Invite others to the table. We talked about working with our diversity and inclusion group. We talked about working with our health and safety people, our vendors, our corp communications. Why? Well, you start scratching the surface on what they can do. They were happy to come and partner with us. I might be rambling a little bit, but I think it's just, continue to evolve, continue to look and be open-minded and frankly, be optimistic, because you can change things. We've seen it. We've seen it in the data. And then taking that data back to those that allowed you to do it, that helps. It makes it easier the next time.
That's right. When you can show the results, right? And say, no, this is making a positive difference. How many years was it, Steve, from when you started till you had that tangible evidence that trends were going in the right direction?
I'm going to say 10.
Yeah. And that's such important information for those who are starting out, who think we'll do it for 3 months and show the return on investment.
No. I was, again, really proud that our EFAP utilization went from 7 to 17%, but it didn't happen in the first year. Mm-hmm. I was really excited when our psychological based long-term disability claims went from 33% of LTD claims down to 20. That didn't happen in 1 year, right? I mean, you have to be in it for the long haul. And that's why I think, Marianne, it's important to, recognize the journey you want to take. It's not always going to be smooth sailing. But you get committed to it. And as you said, you're going to find lots of allies along the way. Use them. And then go back to those and keep them abreast of your progress and how things are, the successes you're having or the challenges you're having.
Yeah. To be able to talk about all of it as part of the conversation rather than being afraid. To be psychologically safe, talking about psychological health and safety.
Exactly. But it was extremely rewarding to be on the benefit team, to have a voice at the leadership table from time to time. Doesn't mean you're always there, but they would listen to you. You would have a voice. They'd be curious. They'd want to know. And, we weren't just the claims payers. We were managing the health and well-being of the employees and their families. And I think just positioning it that way helped us a great deal.
Mm-hmm. Yeah, well, it changes everything, right? If that's your perspective, you're not a number cruncher. Yeah.
No.
Supporting health and well-being.
I think our carriers liked it when I said paying claims is easy. We don't need you to do that. We'll just write checks. But managing those claims and bringing them down, that's where the magic was.
Yeah, helping people not just to be off and come back with or without any improvement in their well-being. It just seems a waste of time, right? Yeah. Steve,
before we go on, I want to say one quick thing. We also invested a lot in the team. So, the team got educated on psychological well-being. They got educated on management. They worked with the suppliers as well. So, they really skilled up too. And that helped the machine run along.
Mm-hmm. Yes, it makes a difference, right? That they're not just dancing in the dark, that they really have what they need to optimize their effectiveness. So that's great. Believe it or not, we're running out of time. And I have another question that I really want you to answer, which is, if you were talking to someone who didn't know the standard, who didn't know Guarding Minds or any of the other tools that assess psychological health and safety, and they wanted to know what it feels like to be in a psychologically healthy and safe workplace, how would you describe it?
It feels comfortable. You feel safe. You feel at home. You don't feel anxious. You walk into a room and you feel like you belong. Like it's like Norm on Cheers. See who recognizes that line. Perhaps a sense of belonging, Marianne, and you part of the team, that you can contribute to the team, and you have value in the team's success. You have a role to play in the team's success, and maybe that's the word I'm looking for. Is that validation that I belong and I can contribute and I can help and people. I had an experience a number of years ago as an athlete, and I moved across the country to join another team. And early on in might have been the first day, one of the senior guys on the team, and he was on the national team, and somebody I looked up to said, "Steve, great to have you here. I'm so excited that you're here." I didn't even know he knew my name. But you can imagine how I felt.
Yeah. Just that somebody noticed you, that you belong, that you're valued. It's such an important thing. So well said, Steve. Thank you. What are you doing these days? Are you still at Husky doing the same thing, or are you?
No. Husky and Synovus are in the process of a merger. Synovus purchased Husky. And I hope I supported. I worked through that integration for about a year. And last summer, I left the organization. And I'm still quite passionate about this work. And so I'm just continuing to do sort of research and read things, talk to people like yourself, Marianne. I have been doing some work with the Mental Health Commission of Canada. And I'm working towards being able to deliver that program I described earlier called The Working Mind.
Great.
So I'd like to continue to work in the field to some degree, but I'm not actively employed right now.
So what if somebody wanted to reach you, either to hire you to do The Working Mind or hire you to talk to them about their benefits and their approach to well-being? How would they get in touch with you?
Well, thanks, Marianne. I'd be thrilled to talk to anybody about any of those things. Probably LinkedIn, or if I share with you at the end of this session, my connections are through LinkedIn, that would be fine. That'd be fine. I'd be happy to entertain those opportunities. Thank you.
Excellent. All right. Well, Steve, thanks for going back in time with me to the way it used to be, and how people like you brought this forward to the way that it is today. There will be a couple of clips on LinkedIn, and the whole podcast will be on psychhealthandsafetycanada.com. And it's also going to be on the Flourish DX website, which is another great new resource for assessing both psychological health and safety and well-being. But thanks for your time, Steve. And I'm glad to see you're still making a difference in the world.
Thank you. Thank you, Marianne. And thank you for your interest in our story and setting this time aside to chat about it. I really enjoyed it. Thank you.
You've been listening to the Psych Health and Safety Canada podcast. To stay up to date with the best content on workplace mental health in North America, subscribe wherever you listen to podcasts and join the Flourish DX community at www.flourishdx.com.